Hello all, this is Dr. Dheeraj Masapu, and in this video I'm going to tell you how to actually earn around above 5 lakh rupees per month. So basically two types of people among doctors I have seen. Some are actually stuck in a range of between around 1 to 1.5 to 2 lakhs or maximum 2.5 lakhs they would earn, and there are another set of doctors who actually cross 5, 6, 7, 8 and 10, and there is no upper limit. So why is the difference coming? Okay, both the doctors have done their PG, have done the super specialties or MBBS or whatever it is, there is a difference coming. So what is actually leading to that difference? I have seen many successful doctors and unsuccessful ones and came to few conclusions which I am going to tell you today. So basically the number one thing that you need to understand is the people who are crossing this kind of crazy salaries or crazy incomes who are generating are usually best in their fields. Okay, so here another very important thing that they are doing is they are not telling the world that they know everything. Okay, what they are telling is usually, for example, a subject is there. You can name any subject. If you take for example surgery, then again in that you will specialize. You have to specialize in one area, right? For example, you have to do MCH in neurosurgery or MCH in gastrosurgery or oncosurgery, and even after that there are so many people actually in the market at present. So again what they do is they usually go to one area and tell the world that this is the area I will do. And then at the same time, when you're choosing such kind of an area, there is a risk. If the patient base is very less in that, then it will be very difficult for you to survive. So that is where the intelligence comes in. That is where working with good people will help, because if you have some good mentors, they can help you in understanding whether that area has enough patients so that you can shine in that particular area. At the same time, you cannot tell that I will deal all types of gastrosurgeries since you are MCH in that, or you are a neurosurgeon, you will deal all kinds of brain and all kinds of spine cases. So that also wouldn't work out. So you need to select an area and tell the world that I am the number one in that particular area, so that no confusion will be there. You are branded in that area, and patients, when they search in Google or they inquire with somebody organically, the channels would directly lead to you. You don't have to market yourself once you actually reach that situation. So next step is, how many years will it take, Dr. Dheeraj, once you select an area? Okay, so usually what I am observing is it is taking around 10 years. Even for anesthesia doctors, I would recommend, who are following my videos, 50% anesthetists, even for them I recommend that you don't tell people that you do all types of cases. So what happens is, if you do all types of cases, you will be stuck in that 1.5 2 lakh range. When you tell the world that I give anesthesia for one genre of cases, and then along with that I can do so many other things, like if you hire me, I can do research for the hospital, research for the department, I can train people, I have leadership skills, I have some other things, and you can conduct the conferences, or you can actually present, you can so many extra things you have to get to the plate. You can only do when you have command in one area, command in the subject in one area. Only then you get the confidence to go out and talk in front of people. If you don't have that kind of command in the subject, then you will not have the confidence to talk in front of masses. So this applies to any specialty. So here social media and everything, if you ask, social media, or as I always tell, is only 5 to 10%. The most important thing is identifying which area you have to work on for 7 to 10 years. For that, you cannot go into Google or Chat GPT and ask it. It is not that easy. For that, you have to work with some of the best guys who are actually in the situation where you want to reach, and do some apprenticeship under them for 2 to 3 years. Even for less salary, you have to work under them, and they will actually guide you, and they will tell you which areas are actually working out, and what is the patient base in each area, and then which areas actually you need to focus in future, because they are practicing at that point of time and you would be practicing in the next 10 years, 20 years down the line. So what specialties are going to come, what kind of trends they are seeing in future is what they are going to tell you. So this is what you have to do. Not directly starting your practice and doing some social media posts, Instagram, YouTube videos and all that you guys are doing, that doesn't work out. So this is the path you have to follow. So if you follow the process which I told, then there is no upper limit. You'll easily cross 5, 6, 7, 8, 9, 10, and it will keep going up like that. So, but only thing is you have to follow the method which I told in this particular video. So this is about the 5 lakh per month video. And another important thing is I started mentorship, and then the link is there in the description. You can actually click on that, and about this concept we can discuss for more time, and then you can follow up at certain intervals so that you can actually assess your progress also. This is what we can do. So some people call it whatever I explained till now, some people call it branding, but I don't know much about the branding and all, but what I really saw in people is what I tried to convey in this particular video. So thank you all, thank you for following the video. And then the next video which I am doing is about how to actually invest the money, and then once you make money, actually you shouldn't lose, right? How to invest in different platforms. I make an mnemonic called as Money Grow. So then if you actually invest your money in that process, what happens is your money will actually grow to next level. That is the next video which is going to come. Okay, thank you guys, thank you for following the video till now. Roger that.